Okay, hello. In this video we are going to discuss how to do the manipulation technique of the third stage of labor. So before starting the manipulation technique, let's see how the mannequin has been arranged. So this is what we have, the mannequin, and when we try to palpate the mannequin, this is how the position of uterus and placenta has been fixed. This placenta is usually inside the uterus, but we have it outside just for this mannequin, and this is how we will see the mannequin when we start the manipulation. And why is it important to know about the position of the uterus? Because while palpating in the starting stage, this can be near to the abdomen, and when we palpate it later, it may go down also. We'll get a task that we have a lady who has just delivered her baby, and then we need to manipulate her for the third stage of labor. So how will we start? We'll start by introducing ourselves, then we'll ask her about her complaints, we'll take her consent, then we'll wash our hands, and then we'll gather all the equipments. And this is how we will start. So let's start it. Hello, my name is Shubham Mishra. I'm a student of final year. I've been given task. May I know your name, please? Okay. Do you have any other complaints except labor pain? No? Okay. So will you allow me to help you? Thank you. So why I ask her about her other complaints? Because suppose she is having hypertension. So we need to provide her magnesium sulfate as soon as possible. Or any other complaints, like she might feel disoriented because of blood loss. So we should manage it at the current moment instead of delaying it. So after this, I'll wash my hands.
Your hands are clean.
Then we'll gather all the equipments we need. We need oxytocin, we need antiseptic, we need gauze, we need sponge forceps, we need scissors, syringes, and a pair of sterile gloves. Now I'm wearing the gloves. After that, I'll start the manipulation. Okay, now what we'll do next is we'll palpate the abdomen to exclude the chances of another baby. If we come to a conclusion that there is no other baby, then we'll give oxytocin as a prophylactic measure for preventing the postpartum hemorrhage. We'll give 10 units intramuscular. After this, we'll clamp the umbilical cord. We need two forceps. First, we'll clamp near the perineum, and the second, we'll use the technique of milking, and we'll clamp at a distance of 2 cm from the first forceps. Then we'll take the scissor to cut the umbilical cord. After cutting the umbilical cord, we'll remove the second forceps, and we'll keep the umbilical cord with the only forceps and towards the perineum. Then we'll try keep it in a tangent manner. We should avoid pulling the umbilical cord. Then we'll palpate the uterus from above, and we should if we feel the uterus turning into a globular position and shape, and umbilical cord lengthening, then we should try to pull it slightly with a minimum amount of pressure. Along with pulling the umbilical cord, do not forget to provide counter traction in order to prevent the uterine inversion. Stop pulling the umbilical cord once you see the placental margin. Try to collect the placenta with both the hands, folding it. Then take it slightly outside gently, and rotating it so that you can collect all the membranes of the placenta, and then keep it into the medical tray. After the delivery of the placenta, the labor is over. Now we'll check for the membranes of placenta. Then we'll check the margins. Is it proper? After that, we'll check the surface of placenta. If everything is good, next we'll check the tone of the uterus. We'll find the uterus below umbilicus and firm. After that, we'll check for any laceration, and then we'll check the amount of blood loss. After this, the immediate management for the post delivery is over. After all this, we'll ask the lady to urinate if she can. It's good. If she cannot, we'll apply catheter. Then we'll ask to clean the surrounding for her. Then she'll be there in the same room for next 2 post-delivery hours, and in every 15 minutes we'll check the complaints for her, we'll check the uterine tone, and we'll check the amount of blood loss. Why we check these things? Because it is very common post-delivery. Then we may also check for blood pressure, we may also check for pulse rate,